All right, we are back with Catherine Sevier with AARP, Steve Edmonds with Alliance Insurance Services, and Laura Packard from Healthcare Voices to answer your ACA and Medicare questions. Catherine, this person says, can you have both AARP and Medicare?
Absolutely, you can. AARP has a variety of different plans. Many of them are supplemental to Medicare, but never ever avoid enrolling in Medicare no matter what, because at 65, 3 months before to 3 months after, you need to sign up for Medicare because it will otherwise affect you for the rest of your life in terms of how much it costs you.
All right, and we do have a graphic for that. So folks, let's put that up, the graphic for the timeline for Medicare, because we want to make sure that we get this information out. This is one of the most common questions that we get is when do you have to sign up for Medicare? And that is when you are turning 65. There's no like ifs, ands, or buts about it. Even if you are working at a job where you get health care, you actually have to enroll in Medicare when you're 65. Otherwise, you will be penalized for the rest of your life. So you have a 7-month enrollment period. 3 months before your 61st birthday, your birthday month, and then 3 months afterwards. So I want to make sure that we made that clear. All right, Laura, let's ask this. This person says, can my 22-year-old son enroll in Medicaid now since he doesn't have much money?
Maybe. They may be eligible for Medicaid, little unclear depending on their income level, but Medicaid expansion hasn't happened yet. It's not until December 1st. So check back after December 1st to see if you are eligible. And North Carolina suggests you go to epass.nc.gov to start the process of applying.
Okay. Steve, this person says there are so many commercials about getting help with a review. Who do we call and is it free?
So if you're dealing with an insurance agent, independent insurance agents market Medicare products as well as a lot of other insurance companies. But my recommendation probably when you're checking is to get a referral from somebody. You know, ask your neighbors, ask your friends, ask folks in social groups that you deal with, and get referrals where you're talking with reputable people, because a lot of the ads that you see on TV or even sometimes a lot of the literature that you're getting in the mail, the plans that you see there are not always bad plans, but some of them have really high out-of-pocket maximums, and you want to be sure that you don't get hooked into a plan that's not going to cover you very well. So my recommendation, get a referral from someone that you know and trust, and that's hard to go wrong, you know.
Okay.
And also you can go to localhelp.healthcare.gov to find someone local to talk you through your Affordable Care Act options.
Okay, great, for both sides. This is interesting, Catherine. I'm thinking this is a scam. Someone called to say my Medicare card needs updating from paper to plastic. Is there a different kind of card?
No, that is a scam. So be careful when you get that kind of information. Medicare will never do that. They will never call you up in those circumstances and say something like that.
Okay. This is a Medicaid question. Laura, is the new Medicaid based solely on income? And is it full service Medicaid or just family planning?
It is full service Medicaid, all of the benefits, comprehensive, including primary care, hospital, maternity, vision, and hearing, if you're eligible. It is based on your income level unless you have a condition such as a disability that would make you eligible for Medicaid apart from income. So there's different requirements to see if you're eligible for Medicaid now, but in the expansion, it's based on income.
Okay. Catherine, this person's asking, what's the difference between Medicare and Medicaid, and can you qualify for both?
So there is Medicare is the plan that kicks in at age 65, and virtually everyone in the United States that's worked or here is a Medicare recipient. Medicaid is a lower income plan. There are people who are older who are qualified for Medicaid as well as Medicare. They're called dual eligible folks. And again, it's income driven.